Namaste. Welcome to Nationalist Hub English channel, a channel which is focused on presenting nationalistic viewpoint on what is happening across the world, and especially that which impacts Bharat. Friends, today I'm glad to present to you Professor Srikanth Kondapalli from JNU. He is an expert on China. He has been studying China. He actually can speak Mandarin as well. He's been on our show earlier as well. He keeps a very keen, close eye watch on China. And as you all know, China is unwinding right now with the Chinese coronavirus, Wuhan virus, which has gone out of control. More than 60-70% of the country is likely to be infected, and the death toll going into millions. So the economy in tailspin, and so their implications on Bharat. These are some of the things that we're going to speak to Professor Srikanth today. So let's all welcome Srikanth. Srikanth, namaste. Welcome to Nationalist Hub. Sir, to start with, if you could give us a brief understanding of what exactly is happening on the coronavirus situation in China. We have seen a lot of horrifying videos in terms of their ICUs completely filled with patients, even sitting on the floor, on toilet, places and whatnot. And we have seen the crematoriums working 24/7. Still, the queues are running into miles together. We have seen a lot of horrific stories. There ibuprofen not being available, and vaccines from Bharat being smuggled into that and being sold at exorbitant prices. So we've seen all these videos, but then I'm sure you have a much larger, much deeper perspective about it. So we would like to hear from you, sir. What exactly is the ground situation in China today?
In 2019 October, we first saw the number of cases increasing in Wuhan. And by January 23rd, 2020, they shut down Wuhan and lockdowns continued in various cities in China. But before that, 5 million people have spanned outside, and we did receive 2 students from Wuhan who came from Kunming to Kolkata, from Kolkata to Kerala. And that led to a huge infection in India. Also, we had received several patients, or rather infected people from Europe, because there is a flight from Wuhan to Lombardy, and several thousand people have gone in that span from October 2019 to January 2020. This figure of 5 million was given by Wuhan mayor, who was dismissed later on. And so this must be credible information on the 5 million people going outside China. Now, subsequently, the Chinese claim that they have been open, transparent, and efficient in organizing the COVID-related. So it basically included border controls, very stiff monitoring, and intrusive. For example, if you have to go out, then the PCR test is needed, and if there is a red line or even amber line light, then you cannot go outside. And for each of these tests, you have to pay 600 yuan, that's about 6,000 rupees. And you have to do it regularly every day and at your own cost. In India, we have, for instance, subsidized some 600 rupees is a PCR test. That comes to about 60 renminbi, while the Chinese one is pretty expensive. Second, the vaccines are also very expensive in China. While it is coming to about $200 to $300, sometimes it can go far beyond, especially those they are selling to other countries like Southeast Asia, Brazil, and other West Asian African countries. They are charging a lot for the vaccines. They manufacture 2 vaccines, and Sinopharma is said to be only 56% effective. Brazilians found out that they are not that effective in their fight against the pandemic. So one, you have to pay for yourselves on this, all of these tests, and then the vaccines are ineffective. And older people generally have not taken the vaccines because of the blood clot and other problems. And these are the most vulnerable people in China even today. And many of the casualties have happened with this age cohort. So this is actually the problematic. So the lockdown conditions meant that actually the Chinese were not able to get the antibodies from their own, they are not able to generate them. So lockdowns initially helped, but it did not lead to herd immunity. The vaccination was supposed to create herd immunity, but because the vaccines are not universal and not effective, so there once the Chinese government suddenly opened up under pressure from the protesters since November last year. So as a result, they suddenly opened up without any consideration for the welfare of the people. And that resulted in, according to Airfinity, a UK-based think tank, nearly 230 million people are infected in China today, and 5,000 to 6,000 deaths a day is what they predict. And some satellite pictures have shown about the mortuaries being flooded and vehicles standing outside in hundreds. So as you also mentioned, the ICUs have been problematic. The National Health Commission, the apex body in China, said they have 138,000 hospital beds, and ICUs are about 64,000. Actually, the numbers have actually fallen down in the last 2 years. And there is huge pressure on the health establishment in China on how to address this issue of increasing infections in China today. So this is a very bad news for the Chinese people, as the Communist Party suddenly lifted its hands and said, you have to fend for yourselves now. Very cynical way it has been done. And this suggests that while Communist Party Congress in October, 20th Party Congress, reiterated the dynamic zero COVID policy, nevertheless, the sudden, within a month, by November 20th, they announced some relaxation in the zero COVID policy. And within 10 days after the protest, the whole thing has been opened up. So there was not enough time for the people to prepare themselves for in terms of these infections. So this is a big mistake the Chinese government made. And obviously, there will be explanations that would be demanded by the people concerned in millions in China. So actually, this is a very tragic situation in China today.
Share this video, like, subscribe, and comment, and then encourage a nationalistic channel like Nationalist Hub.